Hey everyone, welcome back to Civil Convo with Rachel. Today we are talking about something super important for, well, pretty much everybody. We are diving into the new 2025 guidelines from the American Heart Association and the American College of Cardiology. And trust me, it's not as boring as it sounds. We are talking about your blood pressure, okay? And more specifically, how to keep yours in check. Just a quick heads up. The information in this video is for educational purposes only, and it's not medical advice. Always talk to a qualified healthcare professional about any health concern or before making any decision about your health. First thing first. Did you know that almost half of all adults in the US have high blood pressure? That's a huge number, right? What's even scarier is that it is the number one preventable risk factor for some of the scariest stuff out there, like heart attack, stroke, and even dementia. Yikes. The World Health Organization, WHO, even state that if we can prevent, detect, and treat high blood pressure, we can prevent a staggering 76 million deaths between now and 2050. Wow, we can actually prevent 76 million deaths globally, y'all. Now, that's a future we're fighting for, right? But before we go any further, let's do a quick refresher on what blood pressure actually is. We talked about it in two numbers, right? Like 120 over 80. The first number is systolic. It's the maximum pressure when your heart contracts and pushes blood out. The second number is diastolic, the minimum pressure when your heart relaxes between beats. Ideally, we want to see those numbers at 120 millimeters of mercury or below. These new guidelines are all about earlier action and intervention. To start with, the American Heart Association advises that anyone can develop high blood pressure, so it is important to have it checked regularly. Also, they really emphasize the importance of lifestyle changes to help control your blood pressure. We are talking about things like limiting sodium and alcohol, eating a heart healthy diet, staying physically active, and managing your weight and stress. Isn't that great news? It totally empowers us to take control over our lives. Here are the 5 key updates. First up is target systolic blood pressure. The goal for adults with high blood pressure is now 130 millimeters of mercury or below, with an ideal target of 120. The second one is cognitive health link. There is now clear evidence that aggressively lowering your blood pressure can reduce the risk of cognitive decline and dementia. Who knew our heart and brains were so linked in this way? Third is medication and lifestyle. If your average blood pressure is 130 over 80 or more, and your 10-year cardiovascular disease risk is low, below 7.5% as defined by the Prevent Risk Calculator, they recommend trying 3 to 6 months of lifestyle changes first. But if it's still high, medication might be added. Fourth is sodium smart. They are recommending moving towards an ideal limit of 1,500 milligrams per day for sodium consumption. That's a significant reduction for many of us. Finally is alcohol awareness. The advice is to stop consuming alcohol, or at least reduce it to less than 1 drink per day for women and less than 2 drinks per day for men. The new guideline reinforces what we've always heard, but it is so important that it bears repeating. We are talking about eating a nutritious diet, getting physically active, and maintaining a healthy weight. These aren't just buzzwords, people. They are foundational to your health. Now, if lifestyle changes aren't enough, the guidelines are making a strong push for earlier medication. This isn't about just preventing heart attack and stroke. It's also about protecting your brain. The new research confirmed a strong link between blood pressure and brain health, including cognitive function and dementia. So, getting your blood pressure under control early can help you stay sharp for years to come. And this isn't a one size fits all either. The new guideline introducing something really cool called the Prevent Risk Calculator. It is a new tool that helps doctors personalize your care by estimating your risk of a cardiovascular event over 10 or 30 years. It even considers social factors like your zip code. How amazing is that, right? It really helps your care be tailored just for you. Another major highlight is the focus on managing blood pressure before, during, and after pregnancy. High blood pressure during pregnancy can lead to serious complications for both mom and baby, like preeclampsia. The new guideline recommends earlier treatment with medication for pregnant women with chronic hypertension. This can really make a difference in reducing serious risk. Plus, they are stressing the importance of continued monitoring after delivery. So, to wrap things up, the new 2025 guideline, it's all about a fresh, proactive approach. It's about empowering us to take control of our health through lifestyle changes, early interventions, and personalized care. It is a real game changer, y'all. Thanks for watching. Join me next time as we dive into another topic that affects our everyday lives. Until then, stay curious, stay informed, and stay healthy.